Here we have Matt, and we are doing his 1 month follow-up after he had his laser-guided stem cell therapy for the bone-on-bone osteoarthritis of his hip joint. And Matt, if you could chime in on what improvements you felt in your hip, if any.
Well, I like I said, I've had marked improvement in my ability to walk, sleep on the side where the hip is, my right side, which is the affected hip. And I can pretty much get through the day, but it starts waning toward the early evening.
Whereas before it hurt you right when you woke up.
Yes.
But now you can go a whole day at work and it holds it off till the evening, right?
Yes. I still limp, but I don't, at least I'm able to get around. Before I was carrying a cane and I was barely getting around. So my lady friend has a question, how long is this going to take? She wants to know, because she wants me to go golfing with her. Well, I can't go golfing yet, I can tell you that.
Yeah, like I said, it's a year program. I'll give you the green light when you can go golf.
Okay,
Some people, sometimes after 3 months. But, you know, so far you're ahead of the game. You're making great progress.
Thank you.
So overall, about 20% improvement, I'd say, which is great.
That's
and it's only been a month.
It's only been 4 weeks, exactly.
Yeah, and you don't have to rely on your cane. Could you show me how you could get up your mobility? Go ahead and get up. All right, and go ahead and start walking. All right, but the limping is a lot better. I could tell you're not leaning as much.
Yes.
Yeah. All right, great. You're making.
I think it's because I favored the right side so long.
There you go.
I think it still expects me to favor it.
Exactly. Yeah.
Mentally.
There you go. All right, you're making great progress, and we'll do another follow-up at your 3 months mark post-procedure. Congratulations.
Thank you.
So, you know, earlier we saw the improvements Matt had for his stem cells. We put him his bone-on-bone hip. He was literally scheduled for a hip replacement, but with the improvement, looks like you're not going to have that done.
Correct. Yeah.
And then what else did you notice after we did the stem cells last month?
Well, I'd gone to Dr. Trong, my internist, and he was very happy that I was having stem cells. I mean, they can't tell you. So when I told him I had stem cell and I hadn't had the surgery, he said, "Man, I'm so proud of you."
Yeah.
You know. And then I went to Dr. Van, my heart doctor, and he did the same. I mean, they were so happy. And then he's checking my heart, and he said, "You know, you don't have that heart arrhythmia anymore. It has corrected itself."
Wow.
And he was very surprised. And I said, "Well, that's..."
You don't have to have a stent or any type of heart surgery then,
No
right?
shocking or anything.
Wow.
Yeah. So it was great.
So what happened was, you see the stem cells, although we put it in the hip, they create what's called signaling. So if you have any type of disorder in the heart, and they do circulate in your blood, so obviously the stem cells also went to your heart and corrected the arrhythmia. Isn't that incredible?
It's incredible.
Yeah.
The doctor was very happy about it. So.
Yeah. So that was a bonus that you got we didn't expect.
That's true.
And
That's true. I thought I'd tell you before I left.
Well, let's keep the progress going.